1 o'clock, because then if we get backed up, then everybody gets backed up. Okay, we are back from our lunch, and up next is our Veterans Service Agency presentation. Introduce yourself, please.
Good afternoon. I'm Greg Carlson, the Director of Veteran Services for Chautauqua County. Our budget is simple and straightforward. I'll start with the Veteran Service Agency FTE summary for 2026. In 2025, we started the year with an FTE of 3.72. This consisted of a 1.0 for myself, a 0.86 for our administrative aide, a 0.86 for the PFC Dwyer Program Coordinator, and 0.5 for each of the 2 Veteran Service Officer positions, one in Jamestown and one in Dunkirk. The other 0.5 for the 2 service officers is covered by the Department of Social Services. In 2026, our total FTE is reduced to 2.92. The Director and 2 service officer FTE values are unchanged, but the administrative aide is increased from a 0.86 to a 0.92. The position is picking up an additional duty necessitating the small increase in hours, and the PFC Dwyer Program Coordinator is no longer assigned to the Veteran Service Agency. After the PFC Dwyer Program Coordinator retired, the program was contracted out to the Resource Center. This change will have a minimal impact on the contract as the PFC Dwyer program is funded by a state grant and has no effect on local share. Next, I'll go over the big picture, and that is local share. Our adopted budget for 2025 came in at $291,967, and for 2026 is projected to be $301,916. This is an increase of $9,949 or 3% from 2025 to 2026. Almost everything in our budget is fixed and recurring. There are 2 items of note differing from past years. The first is an increase to our contractual expenses. There is a $15,351 increase to our contractual expenses. This is due primarily to an increase in our rent. Prior to TRC taking over the PFC Dwyer grant, rent cost was shared for the Warwick Plaza office location. There is also a fairly significant savings in 2020 from 2025 to 2026 in health insurance. Though this is outside of our control, it is likely due to the new service officer in Dunkirk opting out of employee-funded health insurance. There are no other notable changes to the budget from years past. I'll now open it up to any questions you may have.
Any questions?
Since I'm not on any of the committees that look at this, can you give us just a thumbnail of what your typical week is like? What do you do week to week?
Okay.
What services do you offer?
So the Chautauqua County Veteran Service Agency has 2 different locations. We have one on the south side of the county in Jamestown, one in Dunkirk. So what we do is we screen veterans and eligible beneficiaries for tangible, meaning actual dollar value VA benefits. And this comes in the form of military disability claims and something called aid and attendance or pension, which is for veterans and surviving spouses who require assistance with the tasks of daily living. We also help veterans get enrolled in health care. I don't actually have the VA numbers in front of me, but our office brings millions of dollars of federal money into Chautauqua County, and we also significantly offset the cost of Medicaid. That's why Department of Social Services chips in for half of our service officers, because if we have someone who is a disabled veteran who qualifies for VA health care and they can go to a nursing home or a VA contracted facility, that offsets the cost of Medicaid directly. But primarily that's what we do, and then we also have kind of the extra, how do I say it, touchy-feely stuff, where you're doing good in the community for veterans, speaking at different events and that sort of thing. But our bread and butter is direct benefits for veterans, federal dollars from the VA into our local community. So, but a typical work week is office hours, seeing veterans throughout the day, filing claims to the Department of Veterans Affairs, screening veterans for benefits.
So it's fundamentally the biggest part of it is gateway for veterans into the...
Correct, yep. Direct representation of veterans to the Department of Veterans Affairs, yes.
Okay, thanks.
We had a discussion on the vehicle a couple months ago.
Yes.
How did that ever pan out?
So as far as the veterans van goes, that is planned into the 2026 budget. The current veterans van, although it is old and it is high in mileage, we put a pretty significant amount of money into the maintenance this year. So we have a new door, for example. We had some cosmetic fixes done. A couple of big things. So the van right now is operational and running, and there's no imminent end in sight, so we decided to continue it through 2026. Now, with that being said, the veterans van in the future, it's a little bit of a complicated or nuanced discussion. The reason for that is we average 2.35 riders per trip. And if you take away 2 people, that's 44% of our ridership. Since the inception of the van in the 1980s, several things have come to fruition that didn't previously exist. One is the Jamestown Community-Based Outpatient Clinic, the Dunkirk Community-Based Outpatient Clinic, care in the community, video telehealth, access to emergency rooms, access to urgent care, and all of these things were designed specifically not just for us here locally, but across the country for veterans to have increased access to health care. The veterans van costs local share about $30,000 a year, plus a purchase of a new van would be somewhere in the $150,000 range. We looked at some different options. Almost none of them, the juice isn't worth the squeeze. I'm saying beyond the veterans van that we have now. And the reason for that is because for a much lesser cost, we could even set up, there's a couple ideas we're looking at, but on a case-by-case basis, if someone truly needs transportation to the Buffalo VA, we could do that on a case-by-case basis for far less than $30,000 a year, plus the initial $150,000 investment in a van and benefits for the driver and all of those different things. But as of right now, the veterans van is in the 2026 budget. We plan to keep operating the van we have. There's no reason to and we've gone back and forth with it, but with the recent maintenance we've done, there's no reason to end that right now.
Okay.
So that's where we're at.
Great.
I got a question. I'm just kind of curious. I'm
Yes, sir.
looking at lodging, and in 2024 it was $702, and there's no other amounts in that for 2025 or 2026. And I'm just wondering what was that in 2024, and do we pay for lodging of veterans?
So all of us who file claims are accredited with either the New York State Division of Veterans Affairs or the American Legion to file claims. So in the past, prior to COVID, every year we would have to do annual training on a recurring basis.
Okay.
And that would require travel to either Albany or Syracuse or, whatever thing for us to maintain our accreditation.
Okay.
When COVID hit, they started doing these things remotely. Okay, so it just so happened that particular year they decided, hey, it's been several years, we're going to do an in-person training that we're all required to go to. Mm-hmm. Then in 2025, this year, they decided to go back to doing it remotely. So that's why we had it that one year and we don't have it other years.
Okay, so that was for
Training, yeah.
Training, okay.
For accreditation training, yes.
Thank you.
Mm-hmm.
Anything else? Okay. I guess that's it.
Is that 15 minutes on the nose?
No.
Not even.
Good job.
All right. Thank you.
Thank you.
Thank you, Tom. If they only had page numbers.
Okay. Guess we're waiting probably or are we gonna, is Dana coming or?
Dana is on vacation at the moment. She's
Oh,
out in the
okay.
country, so I'll be filling in for her.
Okay, all right. So up next is our Office for Aging Services.
Hello, Steve Dando, Grant Coordinator for Office for Aging Services, to present our 2026 tentative budget. Quick overview of the budget as it pertains to our personnel. As you can see, our FTEs are increasing slightly by about 0.7. There's good reason for that. We are proposing the addition of 2 part-time positions, which will completely eliminate 2 contractual line items that have been previously budgeted for. Just to put some numbers on that, the total cost of the positions that we are budgeting for total $43,673, and the previously contracted amounts totaled $62,500. So this is actually going to be an overall savings for the county. And not only that, with them turning into employees, we will be able to fully claim all of their expenses, where previously those contractual expenses may or may not have been under state or federal funding. So they would be completely funded state and federally. As it pertains to the overall budget, we're projecting approximately 20 different funding sources for 2026. 16 of those are state and federal funding. For those that are new or need a reminder, we are required to have a local share for a majority of our state and federal claims. Approximately 50% of all funding sources, we are required to have either a 10 or 25% local share, depending on what type of services are provided. In an ideal world, our budget would have approximately 11% local share. Obviously, we don't live in a perfect world. The typical recommendation is anywhere from 20 to 25% of all of our expenses be local share. From the years 2020 to 2024, it was at about 23.83. And over the past couple of years, we've been really working on getting those numbers down. Where last year, we budgeted at 20.93% local share, and this year we're actually dropping that down to 17.34%. So we're doing our best to gradually get that closer to the ideal number. As it comes to the revenues, there was a reduction in some of our federal funds. It was not as large as we expected. We don't know of any current federal funds that will not be there next year that aren't currently in the budget. To offset that, the state actually increased their allocations despite losing a couple of programs as well, as we have lost the SNAP Ed Shine program, which previously had $148,000 in funding, and an ADVC grant that had $142,000 in funding, but that was offset by, and this just came in recently, so our budget changed within the last month. We got a supplemental increase to our unmet needs funding in the total of $651,000, which helped out our budget considerably. All expenses are increased accordingly. And if you have any further questions, feel free to ask.
Absolutely.
Just a couple questions or comments to you, Steve.
Yes.
One is, I guess I want to take a note and just say thank you to New York State for giving us the unmet needs funding. It really was it's an avenue where they did see a hole and a gap and they filled it. So that's great. You made an allusion to that our local share is down from 24% down to 17%. Were you able to do that by obtaining more funding, or were you able to do that by getting rid of? How did you do that? And are we not? I don't want to be lacking or taking away services, or is it just being more efficient? So how are you making that a decrease?
It's a constant strive to be as efficient as possible. Now, granted, with 20 different funding sources, approximately, it can vary on year to year depending on if we get grants throughout the year and what services are provided. Some services qualify for to be covered by different funding sources, and some of them can be covered by 5, 6, 7 different funding sources. So it creates basically this puzzle of trying to find the best fit for the client, the services provided, and funding source. And it's just a constant shuffling around of trying to find where the best pieces fit so we can maximize all of our potential claims, our claim ceiling. So over the past year, we have been reallocating some funds from one area, from one funding source to another funding source that may allow for having a lower local share. Or if we were projected to go over in one funding source, we've been able to more quickly and accurately shift those services to a different funding source that can also cover those funds, so we can try to maximize our claims as much as possible. And it's just going to be a constant, constant shuffling around until we can really piece that puzzle together.
Anything else? I guess that's it.
All right, excellent, thank you.
Thank you very much. So we'll take a little break until Public Health. We have got up on our agenda now the Health Department. So if you all could introduce yourselves.
Lacey Wilson, Public Health Director.
Mike Falk, Chief Medical Officer.
Blake Eric, Director of Administrative Services.
Okay. Take it away.
All right, so we'll get started with FTE report. Really overall for the department, we have a net zero change in FTEs for this year. We've had some internal reallocations within the department from division to division. One FTE from environmental health to public health admin, and then one, actually 0.7 FTEs reallocated from early intervention to public health admin. And also of note, there is a sharing of an FTE with a nurse practitioner, 75% jail, 25% mental hygiene, but overall a net zero FTEs for the year for 2026. Any questions about the FTE report?
Guess not.
Just a high level summary for the department. We're looking at a total 4% increase in local share, but a negative 3.9 or 3.95% reduction in local share while adding in the opioid settlement funds for 2026 of $700,000 to cover the MAT expenses at the jail. The two general areas that saw increases in the budget were, compared to 25 to 2026, were the jail increase of 9%. Really all of that's going to be accounted for by increase in medication costs and the demands there in the jail and the MAT program. And also for our children and youth with special health care needs and preschool and early intervention programs with increasing transportation costs and provider costs really account for almost all of the increases, while the other divisions are seeing reductions when compared to 2025, including our coroner program, environmental health, and public health administration. So that is sort of the high-level summary for the department altogether. We can dig into the divisions if there's no other questions.
So, question to, if I understand one thing you just said. I went after this earlier today. So you said the opioid settlement was taking our cost inflation rate from positive 4% to negative 3%. But my understanding was that that's a one-time benefit, that opioid settlement, and shouldn't really be counted into kind of ongoing expenses. Did I miss something or not understand?
No, we've been able to utilize the opioid settlement funds yearly for the past 2 years, so 23 and 2024. Those opioid settlement funds are reducing year to year, it seems, but those lawsuits are still being finalized. We're still realizing some income or some revenue from the opioid settlement funds. So while, yes, the reality is, and this is what we've talked about the last 2 years, the reality is that over time, we are going to see a slow reduction in opioid settlement funds that we can apply to this budget. Last year, I believe we were at 750, roughly.
Yeah.
Kitty may be able to
Yeah.
help.
And Dr. Falk, we did talk about the opioid settlement funds coming through OASIS and mental hygiene. So I just want to clarify again, this is a separate pot of opioid settlement funds. These are the settlement funds that come direct to the county. What's budgeted in mental hygiene is what the state received for their settlement that they're sharing with mental hygiene, you know, local government units. So I just want to reiterate that distinction. So, and also just some history on how we've utilized the settlement funds that we've received so far. So it was 2 years ago in the budget hearings when we first we're beginning to realize the new MAT requirements, there was a decision made in the budget to fund the initial cost of the MAT program 100% with opioid settlement funds. So since then, we're kind of tapering that off, the use of the settlement funds. But then at some point, the annual amount of funds that are projected to be received are around somewhere between $200,000 and $250,000 a year over the next 20 years. So, and they can only be used for specific purposes, and they generally would fall under the health department.
Okay, so what you're saying is part of the opioid settlement comes in as an almost a perpetuity, a 20-year number.
Yeah.
And some of it is front-end loaded. In terms of you were at 700,000, it's going to taper down to 200,000.
What I mean is how we've used it. We've used it.
Okay, I'm more interested for starters in what we're getting. Because the opioid settlement to me is a one-time event, a one-time thing, and ought to be used for kind of, as we did with the ARPA funds, one-time-ish expenditures and not just build your expenditure base that then you're going to have to cover, long-term cover out of our own funds. And that's, I get that if 200,000 is ongoing for 20 years, okay, that's ongoing, but the rest of it?
So at the time when the MAT program was first introduced as a mandate, in settling the budget through the hearings that year, there was a decision made to fund 100% of the MAT program with settlement funds that we had already received. Knowing that we had plans, and we're continuing with that plan, to reduce the amount of settlement funds that have been offsetting the MAT program in the budget, meaning it's coming on to the local share. And then the settlement funds going in perpetuity would be utilized, for the specific purposes under the health department.
It still is a mandated program.
The reality is that it's approximately a $1 million mandated, unfunded mandate, $1 million per year roughly.
And 2 years ago, it came down in August or September, right when budget time, and then we were scrambling to find money to fund it.
In that current time, too, it
In
was,
that
our original estimates of the opioid, or the MAP program were much higher than what we've been experiencing, which is good. I think original panic mode was, and I wasn't a big advocate of using opioid funds then, and I do wish that they do continue to taper off of the use of them so heavily, too. I think there's some other programs that could benefit from those funds as well. So I agree with what Fred is saying, is that we should, try to focus on having some other earmarked funds that are more permanent for this use.
And it's just the basic concept of, to the extent we can, and I understand mandates, throw a monkey wrench in the work, but to the extent we can, matching revenue and expenses over time.
Dr. Falk's team, too, has been doing some really creative things around staffing. There's some more short-term things that they've been working on to help reduce the overall costs of that program.
Good.
Because for that very reason, it's difficult to adjust to these mandates. But some more efficiencies in the staffing and how they're running it will certainly help in the more short-term, while the longer-term sustainable funding is sort of sorted out.
No, productivity is a good thing.
And unfortunately, there really isn't much for revenue in that program. We'll touch base a little bit about that in a few minutes, but.
So the $700,000 in use of the opioid settlement funds have not been included in the 2026 tentative budget. Is that correct?
They are. They show up under department miscellaneous. The actual revenue use of the settlement funds are in a different budget than the health department, because that is the accounting treatment for that revenue.
Okay, so the expenses are in the health department, and the revenue is in miscellaneous.
Yeah, 131099.99.
Thank you.
I just wanted to touch on the handicapped children in transportation. Is that an estimate, or, I mean, how did you arrive at that number?
It's a forecasted number that Blake's team works out based on our team's best estimation as to how we see the numbers either rising or dropping in terms of number of children in the program. But there's been a pretty,
Steady escalation.
steady, escalation and increase in these services.
And again, this is a mandated program by the state,
Yes, it's
Partially
actually-
funded mandate, yeah.
partially funded, okay.
We get about 59.5% reimbursement.
Okay.
Dig in a little
Get into
deeper
detail.
with the individual divisions if you're ready to move forward.
Yep.
1185, medical examiners and coroners. Unfortunately, we do not see much for revenue for this program, $2,500. And really what that is some, we are able to get some revenue from the state for reporting some drug overdose data to the amount of about $2,500. Overall, we are looking to reduce our budget relative to 2025 by approximately $69,000, I believe. Much of that savings, I think, relative to last year comes in the way of our coroner supervisor, the use of the coroner vehicle in reducing the number of transports to the medical examiner's office by contractors. Essentially, we've had funeral homes doing those transports for us for roughly $475. We are now able to pay our coroners to do those transport ourselves for $250. Obviously, there's some vehicle maintenance, but and fuel expenses, but overall, those are looking to be a reduction in cost for us for those. Additionally, we intend to take on and reduce the number of decedents that we send to the medical examiner's office by taking care of those ourselves. We've spent a lot of time over the last couple of years building our program. We currently have 5 coroners that are registered nurses and our coroner supervisor with a career full of death investigation as a law enforcement officer. It's a great combination, and we've been able to start increasing training, possibly some interest in certified death investigator status for a couple of our coroners who might be interested. And it's really helping us reduce the number of decedents that we have to send up for autopsy at the medical examiner's office. We have a contract in process now to start doing some of our own tox screens through NMS Labs. The average, every time we decide to send a decedent to the medical examiner's office, it's roughly about $3,000 of expense that we do not have any revenue to cover for. So if we are able to elevate our practice with through our coroners and coroner supervisor and coroner physicians, and if we are able to keep more of those decedents locally, it really reduces that expense from $3,000 down to more like, roughly $500. So part of that reduction in the overall budget for this year compared to 2025 is we're now realizing some of those savings for those reasons.
Can we offer the service to Cattaraugus County, make some money?
Could we? I don't know. They have a little bit different program there because I believe their coroners are elected. I have a feeling. Don't quote me on that 100%, but they're, every county has a little bit different way of running their corner program. Some of the feedback that we've been able to get at some of the state conferences is, we're really being looked at as sort of a leader in the future of how a county should employ a coroner program. And I think we're pretty proud of that. But it, to contract that service out is certainly could be a possibility, but I don't know that they would necessarily be interested, given the fact that I believe their coroners are elected, if I'm not mistaken.
Fair enough.
Questions or comments too? Over the last few years, we've been really working, building this program, and I thank you for the work that you've put into it. And like you just said, you've turned the program into something that the state's looking at as, hey, you guys are really doing a good job with this program. So good work with that. Personnel, we've had a hard time keeping coroners and had some turnover. How is that looking this year? And, as far as, you're talking about a lot of training and stuff, so the investment into the program was heavy in the beginning, and now we are starting to see the fruit of some of those returns, which is great. And, how's the retention been? And I think the training is important. There's some upfront costs for that, but I think if down the road we'll see those savings and maybe be able to farm out some work. But for now, it'd just be great if we could do those services in-house.
Mm-hmm. No, I think you're absolutely right. I think we certainly have opportunities there with the training and that kind of thing, but, yeah.
People are happy and staying in our...
Yeah, I mean, it's always a concern, and it has been a concern up until, over the last 18 months or so. We've really been able to stabilize the program. We've been able to recruit the right people that are interested, that see themselves doing this for a long time, focusing on, hiring individuals who have experience in the field, that know what they're getting into, as opposed to, hiring somebody who has no idea what, how to investigate a death situation, number one, but also, all of the other things that go along with that. It's difficult work.
Seems like throughout the years, counties hired someone, trained them up good, paid for their training, and then the employee moves on to something else. And you're like, start over again. And it's, and we see that a little with this department,
Mm-hmm.
but hopefully we can, it sounds like you're kind of getting more in tune to that. And hopefully moving forward, we can train those people and keep them here too.
Yeah, and I think the ability to have our coroners transport helped. They have the ability to take on those transports themselves and help, increase their own
Make it a little
revenue a little bit,
for 'em, yeah.
while overall seeing a savings. We also have budgeted in the 2026 budget, $1,000 increase to their stipend for the coroners. It's a minimal amount. Their stipends are roughly $13,000 a year, plus they get a case rate of I believe it's $150, if I'm not mistaken. We did not want to really touch the case rate, but because we're asking the coroners to do more work, we're asking them to start thinking about doing blood draws, for example. There's going to be more time processed at the scenes now that we're going to be keeping our own individual cases. And with a flat rate, case rate, we had to figure out a way to increase their administrative stipend a little bit to compensate for that. So despite all of that, we're still seeing some savings, at least relative to 2025 budget.
All right, now you just provoked a question. I'm on the Sheriff's Stop DWI Advisory, and apparently one of the things that's happened with this, along with bail reform, is that if you're pulled over and you ask for a blood test, there's almost no way the state can get that blood test back in time for your trial and you get dismissed. Could we do that locally and then for actually get that done within the time circle?
I don't know the answer to that. I don't know how that would work from a chain of custody standpoint.
I mean, maybe there's
We're
a
just
chance that
saying-
was my understanding of it.
We're just saying it's a timing issue.
Yeah,
Yeah.
it just doesn't come back in time to meet the speedy trial.
Yeah, I mean, our tests that we're going to be sending out are a national lab, NMS Labs. That turnaround time's still going to be about 6 weeks or
So
so,
it's not 6 months.
not 6 months, yeah.
And typically, each department sort of has, depending on the hierarchy at the state or federal level, there are typically mandates as to where and how, what labs they can send those samples to.
Yeah, and
Sometimes
well, that's the root of my question is, do we have, A, the authority to bring it in local, and B, do we have the ability?
Right. That would, yeah, certainly be a question for the sheriff's office, but a good one to ask, because there may be, and I only know that because some things in our department too, with environmental, there are certain things that have to go to the state Wadsworth Lab, and other things that we can negotiate our own terms with, a more local or regional lab on our
Okay.
own. But all specifically dependent on the service.
No, thanks.
The lawyer, Fred, would say, well, you gave us the ticket, and now your lab told us it was this way too, so it's, we want that outside that, set of eyes on that one too.
Additionally, there are some preliminary discussions going on about a local forensic lab as well, which I don't know if that changes much of anything or not, but.
I mean, I'm both left and right on this. We absolutely have a constitutional right to a speedy trial, and so the state needs to get out of its way in terms of getting this job done on time. But when we fix that problem by just putting people out on the street who are guilty, that's not a fix, that's making it worse.
Mr. Chairman, I had a question about the contractual expense, wondering why the 2025 projection is 50% of the 2025 amended budget.
I can make some light of that. So, as you'll see here in the amended version, it is including the ARPA projects, and the amended version too is double counting of the ARPA projects. I believe the projects 79 and 81. During the year-end soft close, the purchase of the vehicle and the morgue, there was an encumbrance on it that I did not catch, that ended up rolling forward when I was doing the year-end process for the ARPA projects. So there's actually a resolution pre-filed for this month here to correct that, so it would be decreasing the amended contractuals by $148,000.
Thank you.
Anything else? Okay. Matt.
4017 jail clinics. Are we all on the same page? All right.
Yes.
So, again, high level here, when we look at the difference between 2025 amended budget and 2026 tentative budget, almost $200,000, really all comes in the way of increased medication expenses.
Price or usage?
More usage.
Why?
The demands are high. 2025, we saw an increase in jail census. Some days we're tipping over 200 incarcerated individuals. Currently, last I checked on Friday, we were at about 186. So increasing numbers of patients. We have been seeing a general trend of more individuals coming in with drug and alcohol issues that require prompt treatment. We have put some mechanisms into place to ensure that these individuals are evaluated quickly. Within the first couple of days, typically, they are placed on medication-assisted treatment for opioid withdrawal, opioid dependence, alcohol dependence, and alcohol withdrawal. These individuals are at much higher risk of medical complications if we don't do that. Seizures, vomiting, a lot of other medical issues that go along with that. And in fact, they're at much higher risk of suicide. We have seen a dramatic reduction in suicide attempts over the last 2 years. We have that data. We have found that many of the suicide attempts within the jail were secondary to the added stressor of opioid withdrawal, which is pretty horrible if you witness it. Personally, I have no interest in seeing these individuals in a significant amount of distress when we have a very reasonable treatment for that, when we're going to get to them anyways. So we've been able to get folks started quicker, and keep in mind that at the county jail, you know, these folks are only in for days to weeks, not months to years. Some are, but a large majority of these people are only in for days to weeks. There's an article that just came out that I printed off this morning from the National Institute on Drug Abuse. This was a study published in the New England Journal of Medicine, analyzed data from 6,400 people at a jail in, I believe it was Massachusetts. 42 of them received medication-assisted treatment, 58 did not, and they realized that receiving medication-assisted treatment in jail is associated with a 52% lower risk of fatal opioid overdose, 24% lower risk of non-fatal opioid overdose, 56% lower risk of death from any cause, and a 12% lower risk of reincarceration after release. So the downstream savings are real. We locally just don't know what those numbers are.
Those overdoses didn't happen while you were in jail, did they?
No. Have we had them at here and there over the years? Sure. That has happened, but they are, if we can get appropriate treatment started, there's much less of a demand for drugs within an incarcerated setting, and a much less risk of overdose in that setting. So there's a lot of different ways to look at it. The reality is that we're looking at, $800,000 worth of medications within the county jail per year. A large portion of that, I think it's $600,000 in medications for the MAP program. We have $150,000 budgeted for other jail drug costs, which are routine medications, some of which are not cheap.
What does MAT stand for?
Medication-assisted treatment. So that's the MAP program and the jail budget were combined into one budget. Last year and the year before, we had that separated out into two different budgets. But it all is really one jail medical budget.
But if you have a diabetic inmate that gets insulin, is that part of MAT? Or?
That's not part of MAT, but that is part of the medications that are budgeted for.
So MAT is...
So medication-assisted treatment is specific to opioid and alcohol treatment.
Okay.
Yeah, those are the medications that we use specifically for those diagnoses.
And $600,000 worth of that?
Those are primarily a long-acting injectable called Sublocade, which is long-acting buprenorphine, which treats opioid use disorder.
Is there, my memory serves right, a cheaper opioid treatment that we do not use?
There are. The oral medications are cheaper. If you compare injectables versus oral medications, the oral medications are clearly cheaper. The problem with giving a controlled substance within a county jail, we have a number of things to take into consideration, primarily safety. in reducing the chances of diversion of these medications. Unfortunately, we find that, and this is, everywhere, medications are diverted for their gain while they're incarcerated. These come in the form of putting medications in an upper lip, hiding them somewhere during the administration of the medication. So there's a lot of moving parts there. These medications can't just be given out like a normal medication, is what it comes down to. So if we were going to do this by not using injectables, we couldn't just eliminate, the injection without some additional expense and manpower. We would have to have probably at least 2 FTEs on the correction side and at least 1 to 2 FTEs on the nursing side to be able to safely administer oral medications every single day. So right now, the process is that these individuals that are on oral medication, some of them are, because by law, if they come in on an oral medication, we have to continue the oral medication, okay? Those individuals have to be escorted from their cell down to medical or a designated area, and they have to get their medication administered. It's a process. They have to sit on their hands, they have to rinse their mouth out, they have to get the medicine, they have to wait 5 minutes or at least rinse the mouth out again, an inspection of the mouth to make sure that medication actually has dissolved. And that takes time, that's a process. There's security issues and we have 60 individuals on the MAT program right now. Maybe 10 or 12 of them receive oral medication. Some of that is methadone, which is much easier because it's a liquid. But that's a process. There's security issues, there's safety issues in transporting from one unit to another, and the corrections officers have to do this back and forth. So if we had to do that for 60 individuals every day, we would realize that we probably have to have about 4 FTEs more. So do the math. So yeah, we could reduce the amount in medication, and we're still looking at some of those things. The sheriff and undersheriff and myself. We've started talking about how we can do this safely. In addition to Captain Stasinski, the warden, we've sat down and tried to figure out ways that we could do this safely without doing the injections. But there are also several studies out there showing that the injections, when we give an injection to somebody, now we have 3 to 4 weeks. It's a once-a-month injection. Somebody has a bridge into the community. Again, reducing drug overdose deaths, reducing hospitalizations, reducing reincarcerations. There's a lot of downstream savings to these things that we just unfortunately can't analyze with personnel that we have currently. But
Can I elaborate on that comment? You were kind of saying about personnel maybe, but you did say that, and you did share some statistics about those parameters, but you said that we can't establish those parameters. How do we get some of those numbers so we know what's working? Like I can be I really just focus on the numbers and making sure our budgeting's correct. I do support the program in its entirety. It's just how we fund it, right? But also, it is nice to know that information on the tail end. What are we doing with it, and is it working? And what are those numbers? So how do we get those numbers? And
yeah, it's a challenge. The sheriff has this CARES program. We have the hub across the street from the jail. Unfortunately, they don't see everyone that gets released from the jail. It's a smaller subset, but they are really working on trying to establish follow-up for the long term with some of these folks. But again, it's more anecdotal as opposed to scientific. The challenge is trying to track these folks down. Once they're out of the jail, they're, within the community or other communities, and the last thing they want to do is stay in contact with anybody from the county or from the jail. So it's difficult to kind of have long-term follow-up. what happens and where these folks go. So you sort of rely on these bigger studies and, somewhat similar communities, and extrapolate from there. But, the only one metric that we have is the reduction in fatal drug overdoses in 2024, 50% reduction. Now, while that's not completely accounted for by the jail, but I'm sure that our MAP program has something to do with that number. Certainly not everything. There's a lot of individual agencies that are involved countywide in a very intimate way with all of that, so.
I mean, we've been kicking it around earlier, it's a fundamental issue in go-forward budgeting is the cost of these programs is crystal clear because we're going to write the check. The benefit is research-based, anecdote-based, and no one person or one organization is responsible for bringing the benefit home. And so we tend to put a much higher discount rate on the benefit flow because it's uncertain, than we do on the cash flow out to achieve it because that is certain. And so that's always the tension we've got is, yeah, that sounds good, but is it really? Whereas the expenditure is what you said it was. And so hence the focus on, I really don't want to spend that money unless I can be more sure of the benefit. And trying to find out who's responsible for delivering it is, in the public sector, sometimes difficult.
Okay, anything else on the jail clinics?
Okay.
Administration.
Does everybody need some steps, stand up, jumping jacks for the health department? You can do that here. I saw the fruit in the back. Good work on that.
Going to need the coroner here.
Okay, no, we don't want to increase those costs.
Start with the ER doctor.
Yeah, there, we've got one right.
Steps.
Well, first, it's always a pleasure for us to be here with you, so we enjoy getting to review this process with you. This is something, just to make you all aware, a part of the strategic planning development that we've been doing in the department, reviewing our budgets and reviewing our programmatic costs, our technical services that we provide is something that we are doing now year-round in the health department, so that by the time we get to emails from Kitty's wonderful team, we are already kind of wrapped up and ready to go to answer questions. So that is not, though, without the help and support of Kitty's department. Specifically, Blake and Diana work very closely with us and deserve a tremendous amount of our gratitude and thanks. So just an opportunity to publicly thank them. But overall, for the next different programmatic areas, there's really sort of three focus areas that we've been moving forward with to present you today what is really a pretty conservative budget on the public health side of things. As Dr. Falk had mentioned, 0 FTEs, account to account, you'll see some shifting around because that was just some reallocating of some FTEs from one department to another. That was sort of just missed maybe another year's budgets, but to right-size them and get them to the right department that they should be posted to. But otherwise, we've really been working on some strategic efforts in the department around staffing, the actual organization of our department, and also our programmatic services that we provide. And the overarching things that we're working toward is streamlining, efficiency, and productivity. We want to ensure this first and foremost. Our mission is to serve the community. So we want our services to be the highest level services that we can provide, but obviously in the most efficient way. So what we've been doing on the staffing side around that is a lot of our succession planning and strategic staffing plans. So as we know, retirements are coming up, we're working to ensure that we have people from within that we could possibly promote or start that hiring process with HR early on to get people in the door to ensure that we have a great warm handoff before all of that knowledge leaves our department. Also, On the organizational side of things, we've been working on maximizing the expertise that's within our department already. So as people are retiring or roles are shifting, we may not need to rehire, lower level positions if we are not providing that direct to service, direct to community service in our department any longer. So instead, utilizing the upper level expertise of our managers to be more of a technical assistance to our community partners or our community agencies. So we've seen, some great returns on that. Programmatically, we're looking at more innovative approaches to the services that we provide. And specifically right-sizing our fee structures on our environmental health side of things. Our environmental team goes out and does a lot of inspections, a lot of permitting of facilities in the community. And so instead of, those costs down the road being transferred over or trickling down to the local share and every taxpayer in the community, we're ensuring that those fees really meet the enforcement capacity within the sanitary code, so that the fees really cover the costs of the work that we're doing. So that has helped. All of these things have helped sort of relieve extra strain on the budget, and specifically local share, and you'll see that throughout the program areas. So specifically in public health admin, this is more so in regards to the way that we're funded through the state, through our state aid reimbursement. So in particular, like my position is funded through this health admin reimbursement through New York State. So they sort of require us to have this separate account. There's really no change in this account. It's pretty straightforward. This was one of the accounts that we moved an FTE out of into our 4090 budget. So that was pretty straightforward.
I'll give you one small editorial comment on something you just said, is when you push fees out to the businesses, that's a cost of doing business, and it goes right into the price of the product and right into the pockets of the taxpayers and the constituents.
We certainly understand that and are sensitive to that. These are just mandated, services. I know you understand this very well. One of the things that we're doing alongside of that, because of course we don't want to have to send our staff out to do these extra, inspections if something has gone wrong or isn't on track with timelines. So one of the programmatic areas that we're working on is really promoting a business-friendly structure. So Jessica's team, specifically around food service, and also water. We're taking a really proactive approach, working with the business partners in the community to get in the front door with specifically new business owners right from the start of their first applications or looking for funding to get started, so that we can walk through the process with them and be very proactive about the sort of technical assistance they might need or things that might be coming down the pike in terms of their water systems or their permitting, so that they don't get down into a year's worth of building a business and then find out the water system doesn't support what they want to do, because that's so costly to the business owner. So it's a new approach that we're taking, because we certainly want our businesses to understand that we're here to help them move through the red tape, not be or add to the red tape.
Good for you. I can think of a house that's being built in my district right now, and they haven't figured out whether they've got a well that works or not.
Okay, tell them to call us if they haven't.
One thing I want to clarify, maybe I'm confused. Are you talking fees or fines?
Well, so fees and fines, you are on our Board of Health, so you
Right.
clearly
'Cause
understand.
We increase fines to cover costs.
Yep. Yep, so fines are specifically different than fees. So fees are, to permit or to start something, and then the
Right.
fines are, have you not done something correct, and you haven't rectified it properly, then there typically are fines that are assessed as well.
But the difference is fees go to everybody, which get passed on.
Sure, I
Fines
understand.
are specific,
I
just generally don't
Yes.
get passed on.
When you originally said that, I was thinking fines, and then you said fees, and...
And it's both, and we're just right-sizing
both.
both to ensure that the, proper costs are being allocated in the proper ways.
Mr. Chairman, I had a couple of detailed questions.
Sure.
I see that you've added substitute pay to the admin. It's also been added to the jail clinics, which I understand why that would be appropriate in a clinic, but Why do we have substitute pay in admin?
Also a clinic, what? Yeah, so the per diem nurse that we added, we also have a clinic space in the health admin budget as well.
Thank you. That's a good answer. My other question is office equipment. We've gone from a zero budget to an $80,000 budget. 40,000 to 80.
The purchasing of cubicles via the infrastructure grant that's fully funded. And it was, in 2025, we had a 40,000.
Yes, 40, yep.
Yes, yes. So we increased it by 40,000.
Fully funded by the grant.
Correct, yep.
I like those words. Thank you.
Anything else? Okay.
Okay, environmental health is where you will see, again, that FTE transferred over to this budget, 4090, so you'll see the slight increase there. But again, overall for the department, it's, just an even trade for that FTE. Otherwise, not much change in this either. You saw last year we had the most change in environmental health, and that really was related to the lead rental registry mandate from the state, but that is also really funded completely by New York State as well. So we are well on our way in terms of getting the staff in, trained, and ready to go, and just waiting for the remainder of the regulation to come from New York State to actually get that lead rental registry started. But other than that, there is, again, not much change in this department. I don't know if you have specific questions, but not much to highlight for you.
That's environmental health.
Yes.
Yes.
Just looking at, you mentioned that you're adjusting some of the fees. So I was looking in some of the line item detail where you're experiencing some differences there. Under that, there's public health food service. That's a big increase. It's line item number A4090, R160.
110.
So I can speak a little bit to that. We ended up increasing it just solely based off of actual amounts in 2025 and kind of what we've seen in the past trends as well. So we felt it was reasonable to increase that revenue line item.
What is that specifically?
So that would be like the permitting of food service facilities, so ensuring that all of their sanitation practices are happening in the ways that they should. So we send staff out to do that food service inspection.
Yep.
Anecdotally, after COVID and a lot of the tourism things that are happening in our community, you would expect to see, more permits because more people are perhaps coming to provide their service in our community.
But double?
Food trucks are new, so a number of municipalities have now allowed food trucks to, provide services in their communities. So that did increase a large amount. Jessica, I don't know if you know how many offhand?
I don't have an exact number for you, but I will say it is an increasingly popular idea that people think is going to be their next big ticket.
It's also something, that allows, obviously you can travel from, distances outside of Chautauqua County to bring your food truck here. So when we have fairs, festivals, things like that, it does provide more opportunity for businesses to come and be open here.
Okay.
We were, 2024 actual was 104,000. I think 2025, we just missed the mark there. But we're already, through September at almost $70,000.
Yeah.
So.
That's through June, too.
No, and I like that, and it's, I think your statement of making sure the fees are at where they should be and not having the rest of the taxpayers get the bill. I appreciate that in a sense too, is some of that industry, I understand, it may hurt the industry a little bit, but, why, if I'm not taking part of that industry at all, why should some, it's a balance, it really is. And I think that, looking at those fees over time is important because they need to be adjusted over time and they do need to help experience some of the county's costs in administering that program. Some of it is associated with the service and protecting the community, and some of it is, making sure that those companies and organizations are doing what they need to do so it's, you gotta have a good, happy mix there.
And overwhelmingly, what we see, and I know Jessica's team would attest to this as well, there are so many wonderful, especially local business owners that are doing the right things. And so when we do the fee structures the way they are, and they come and they, it keeps you accountable to that, it helps protect them as well in the long run because they are tied in with us. We are walking through the process with them. It also helps to sort of sort out some of the bad actors in the mix who sometimes, we see that as well. So the ones who are coming and doing the right thing, which is the overwhelming majority of our local providers, the fee structure saves them from the fines, which are typically much more expensive than the fee. So that's been what we've seen overwhelmingly in the department. It's been a really nice move, and we've seen a lot of great rapport with our business owners.
But I also know that you've been very proactive, as you said, in working with business owners, especially new business owners, on how to do the right thing. So,
Yeah.
and the fees help pay for that.
Yeah.
And they can take advantage of that if they'd like. Okay, anything else on environmental health?
So the next two accounts, 2960 and 4059, I'll kind of walk you through those in the way the actual programs are provided in the community. So in 2069, that's actually a combination of really sort of two programs. One, children and youth with special health care needs, and also the preschool program. So those are sort of lumped together in this budget worksheet. But these are programs that serve children and young people birth really with the SHIN program up to age 21. These are programs specific to children who are experiencing developmental or physical delays and need extra supports in the community. The pre-K program is a mandated state ed program, technically, and the SHIN program is a state-granted program to us. So the grant covers the cost of the referral and coordination work that is done for those children as well. This is the program that we talk to yearly about in regards to the transportation costs. Transportation is a mandated service as part of this program. This is the service that is reimbursed, both the transportation and providing professional service, at about 59.5% the cost of the actual services. So this is where we see the increases in transportation year to year. Some of that does end up in local share.
Increased transportation, there's more kids?
More kids, it's an
More
expensive, service to provide. There are not, if you weren't aware, there are not a lot of transportation providers in our community. So, there's not a lot driving the cost down in a lot of ways. There are very creative, again, going back to the technical assistance that we're working on, we are working on some really creative and innovative project areas and strategies around transportation to see if we can pilot a few programs to see if there's a potential of bringing these costs down just at the local level, on our own, using the resources of partners and collaborating with other agencies. That takes some time and some work, but we've heard you. And we also do want to just provide the best service to the children in the community as well. So reducing bus ride times, increasing the comfortability for these children, on their transports back and forth to school would also be something that we'd focus on in some of these pilot programs.
Is there any burden on the school districts?
So even though this is a state ed mandated program, the school districts are not required by state mandate to provide the service. So in many cases, These students may be living right next door to a child who is being picked up by that district's school bus, and they are not picking up the child that is part of these programs. There are some special, mandates around the program. There are some special services that need to be provided as part of transporting children of specific ages. So that's a barrier sometimes for the school districts. But I will say there are some school districts that are willing to provide this transportation, and that is one of those project areas that we're working on, really trying to develop strong relationships with our school districts, help them understand the significance of providing transportation to these students as well within their own school districts, and the cost savings that would be, seen countywide, not necessarily in their budgets, though. I think that's, again, a barrier in a lot of ways, but could certainly bring costs down countywide.
So what you're talking about is having the child get on a normal school bus, go to school, and then we'll pick them up there. That sounds like a logical idea.
Yeah, and a lot of these schools do have classrooms right in their schools as well, so the children can attend. So there are special circumstances where they need to attend, a school not within their district. And again, that would be transportation then in those cases that we could still provide.
Wait a minute. Now I'm understanding that you're providing transportation parallel to the local school bus.
Yes.
Is that because of disability or wheelchair accessibility or some of that stuff?
Age is sometimes need in terms of aids on the school buses and things like that. It's cost deterrent. And yes, there are some special equipment in terms of wheelchair lifts and things like that that could be needed. But again, some of our school districts are providing these things, and in other, it's case by case. So in cases where a school may not have the real capacity or just the school bus to provide that type of transportation, we could be the secondary option, certainly, in those cases. But right now, we are primarily the provider of transportation for the children in these programs.
Well, if somehow we can help you lean on the school districts in a broader sense to make sure the logistics at least make sense, that we'd be glad to.
Thank you.
And we contract that out.
It is contracted out, yes.
In here, it's you have choice of a company or two, and that's what it is.
There's typically one.
One A company, yeah. And it's tough. So, your department isn't, this particular program isn't the only transportation issue within the county, and I know other departments struggle with transportation as well. So it's something that the county in general could help utilize. My other reference is Office of the Aging. They really could use some transport help with some of those elderly people. They have services that they could get to or can get to, and I think it could help lessen the burden on some of our nursing homes shortages and things if we could keep some of those people at home if they could fill a gap with some transportation needs. So, transportation needs is important, and it even is into this early intervention program that, there's just not a lot of options in the county, not a lot of drivers in the county either, even if another company came in, are they going to be able to hire people? Because they got to have certain qualifications. So I think, doing some advocating to our local universities, they like to try to tailor some needs, promote a transportation program of some sort,
Well, you will be very happy to hear then that as part of some of the pilot programs, we are working around specifically the aging population as well, knowing that they could benefit from some of these services should, we be able to develop a best practice. It would absolutely be transferable. So Dana and her team will be in the mix of the conversations as we build some of these pilot programs out. And also, I do just want to say the provider that we do work with is a local business provider. So if there is a silver lining there, and they have been very wonderful to work with in terms of accommodating schedules, and we understand to provide the service with limited professionals available and moving all over the county every day, that just is expensive to do on its own.
How many people are we talking about at .com?
Say that again for
How
me?
many children are we talking about at .com?
So in the preschool program, is there around 350 children typically year to year in the program?
Are we just talking about preschool children? or-
This is specific to the pre-K program, yes.
Mr. Chairman, I actually have a non-detailed question, but this might be for Blake as well, but the 2025 amended budget is $9,200,000. The 2025 projection is nearly $10,400,000, and yet the 2026 tentative budget is essentially the same as the projection for 2025. So is that enough in the 2026 budget?
I believe it is for the 2026 budget. And again, these projections are going off of the data that we had, and really the start of September and kind of leading on into the fall is when we'll get majority of our expenses. So it's really difficult to project out for the remaining of the year.
Yeah, it's a very astute question, because the service is primarily centered around the school district and the school year.
Yes.
So while there are still services provided through the summer, there's clearly fewer children during the summer. So we do see costs, so it's sort of like a volatile cost. You know, you see it sort of balloon in September and October, of course, because that's when the school district, school year starts again, and then sort of tailors off again in June. And then you don't really know what the school summer is going to look like until about June or July. So, yeah, it's kind of based on a moving target in terms of...
Well, certainly the expenses would be fluctuating throughout the year, I understand that, but the expenses would be largely based upon the population that you're serving. So when you did the 2025 projection, you didn't have the projected numbers for this fall
26 school year.
Students
Yes.
that would be involved. So could you take another look at your projection, Blake, based upon the population that we're seeing in the fall semester that have been enrolled now, to see if that would change your estimate for 2026? You follow me?
Yeah,
Okay.
absolutely. I can get those numbers to you.
Thank you.
Okay, any other questions on that? Sorry.
That's all right.
Sure.
Same thing. Any other questions? Okay.
The last program, again, that it sort of melds in with the other two, this is the early intervention program. This serves specifically children from birth to 2 years. This is also a mandated program, and we are reimbursed at about a rate of 49% back from DOH from what we provide in the community. This is a DOH mandated program as opposed to state ed, which is preschool. There's not much changing in this program other than, again, it is based on the number of referrals to the program and children that then qualify from those referrals into the program. Did you have a question?
Just a general question. A question was raised earlier that what if we just didn't do a mandated program? What are the ramifications? Let's just say we aren't going to participate.
Right.
What does the state say in that sense? Or what is it?
I've never done that, so I don't quite know from experience, but I can speak from experience just in terms of when we aren't in compliance with even particular parts of a program, you are dinged, you lose funding, basically, if you don't correct that problem within a certain amount of time. And then they can retract from other years of service costs or service revenue that they've provided you as well. They can recoup some of those costs, basically under the guise that they would still end up paying for the downstream costs if these are not taken care of at some time. So, I have seen in other counties that happen where they did not follow a program properly or do it properly, and monies were paid back in millions of dollars from those county budgets.
And it's like, let's just say we don't want to do the MAP program, or if you want to do it, come in and run it yourself. It ends up costing, you can't do it, you got to do it.
Yeah, the State Commission on Corrections is a pretty hardy group of folks that would probably make our lives pretty miserable. Sheriff's life pretty miserable in that regard, but specific to this program, to be kind of a full-service public health program, county health department, we would risk losing all of our state aid.
For every department.
For our
any of
public
their
health,
state
for our
funders.
public health divisions, which would include, yeah.
Yeah, a good
Early
majority of our
intervention.
budget is state-funded work that we do.
But, and it's a point I've been making, more realistically, and I'm going to use the analogy in private sector of dealing with the IRS. In the private sector, we don't take what the IRS tells us face value, we push back. Now, we don't push back so aggressively we get tossed in jail, and we don't push back so aggressively, hopefully, we get fines. But we're happy to push back into the gray area of where eventually we owe the payment with interest if we lose. But we push back.
Yeah.
And consistently and hard. And that's been my question generally is, on these unfunded mandates, how hard do we push? Don't want to go to jail, don't want to get defunded, but there's always a gray area, and some of it's less gray and some of it's more gray, but how aggressive are we?
Well, I think your point is shared by specifically the rural counties in New York State, where we typically have less infrastructure and fewer resources to pull from. So, in an urban area, in terms of providing preschool transportation, that's an easier pull, even if you are only still getting the same reimbursement rate. The cost may not be as expensive. And we hear that in the program, and Wendy has to deal with that quite a bit, where they say, well, there really is a state average of what this costs. Well, we're on the lowest end of that state average in terms of, what, or the highest end really of what that costs, because our capacity is so low. So I think in response, what I've seen, the history, and even really just in the last couple of years, there is a consortium, an association of the county health officials that get together, and we work very closely with that association to push back to state DOH, and we've seen some really great returns from that, in particular for the rural counties. One of those being a $100,000 increase in the base rate payment that we get from our state aid. So that had been around $650,000 for a stagnant, I think, 20 years. Within the last 5 to 10 years, that was raised $100,000 for each county, specific to pushing back that we need more funds to do this work, and we need those funds to be flexible to fill in the gaps that are unique to each county. So not tying that up in a specific way, so we don't want them telling us how to spend that money, but provide us that money in a flexible way where we can fill it in because of our expensive transportation costs or what have you. The other area that we've specifically seen it is the early intervention program that requires private providers to be utilized to provide these professional services to children to improve their development. The state has at some point taken over the payment of that service as well. So that's not a responsibility of ours to contract directly with these providers. There is a secondary cost that comes along with that, the burden to a finance department for the billing, the back-end tracking, the compliance of that. So the association was able to push and ensure that the state take all of that over. So that's been a major cost savings to the counties as well. There's a number of these avenues that we're working on. I'd be happy to talk you through those too, but there's a lot of advocacy work because that sentiment is shared.
Good. I love when we get more funding that way. I was actually going a little farther out on the ice, which is metaphorically, I'm happy to take a continuous scolding from the state just as long as they don't find me, if that's what it takes to push the envelope.
I understand. Yeah, we are trying to walk that fine line of still having a heart and a mission for this work in the community, but doing it in a way that's certainly respectful to the local taxpayer dollars, and utilizing the technical expertise that we're bringing on in our department to diversify our funding so that we aren't so reliant on local share, but that we can also prove to the state the work that we do is desired, by even the funders in our community and our community members.
Thank you.
Thank you.
Okay. Anything else on that? Okay.
That's it.
Guess that's it.
Thank you.
That's it for
All
me.
right. Thank you.
Now you all are going to get up and get some steps. and- Yeah. All right. We'll keep encouraging that. There you go. Do you do that?
That's harder. Well, is there anything that we want to discuss as a group, as long as we're still here?
Yes. Yep.
I heard yes.
We don't want to talk about leave. I think we're pretty good. Covered some good questions. We have some thoughts for down the road, but we need some information first from the departments, so.
Right. Right.
I don't know if we can make any adjustments right now, but.
I don't think so. Nope. There is some information coming, which will then audit control will discuss on Friday. So, nothing else? Okay.
Make a motion to adjourn?
Motion. Second. All in favor of adjourning? Aye. Thanks.
We need to give you a gavel. So we need to give you a gavel.